experts in studio here to answer your questions on Twitter, Facebook, and also some of the videos that you sent to us via WhatsApp. I have with me Professor Rodney Adam from the Aga Khan University Hospital, Dr. Paul Yonga, an infectious diseases travel medicine specialist, Dr. Mercy Mwangangi, who's the Chief Administrative Secretary, Ministry of Health, so the government is fully represented here. We also have Professor Omu Anzala, Professor of Virology and Immunology. Before I lose my voice, I want us to go straight to the next question. Well, I'm not sure if any of you understands that, but David Agondoa tried to help us out on this one. It's about the number 719. And what she's asking is that what will the deaf people do? You have 719, people will call that number. What about those who are deaf, Dr. Mercy?
Right, so we've deployed the 719 number, and we do appreciate that we will need to have an audio-visual mechanism of being able to engage with the deaf. We do have teams working also on translation in terms of Braille to be able to engage with people who may have a need for these extra support services. The 719 number right now is actually what we're advocating for Kenyans to use. Should you have any symptoms, should you feel like you're having that that cough that's deep and you're having difficulties in terms of any chest symptomology, we're actually advocating that instead of rushing to a health facility, you call 719 and then you get guidance as to how to be able to get to the health facility. But I'd like to say and take the guidance that we've received here. We are going to work on seeing how we expand this service to be able to meet the needs of all Kenyans.
Well, Dr. Mercy, there's also another one here that came in a bit earlier also. We've had stories of people breaking out of isolation in other countries. Also in Kenya, we've heard that can a hospital hold you against your will, and does this happen in Kenya?
Right, so we want to be very clear. The government is not taking this coronavirus issue as a joke. And the Cabinet Secretary, Mutahi Kagwe, has actually invoked the Public Health Act. The Public Health Act gives the Cabinet Secretary and the Minister of Health ability to be able to enforce whatever interventions will actually be able to contain this virus. So yes, from invoking the act, we do actually have a mandate now to detain patients, those who might not abide by the instructions issued by government.
And do we have a situation whereby we've had a patient who's broken out of isolation?
So far, I must commend the patients who we have in isolation and those who we've discharged. They've been cooperative. And it's important to note that an isolation or quarantine situation is anxiety-inducing. So we do appreciate that the patients and the families may experience anxieties, and we are working very hard to ensure that it is as comfortable as possible. But it's important to also note that we need to go beyond comfort, and we need to realize that this is a matter of public health emergency, and we need to protect our country. So yes, indeed, we are invoking the Public Health Act, and you will see enforcement of this act in terms of trying to contain COVID-19. Let's
go to our next video, and the question is about immunity.
Can someone become immune to COVID-19, and can the virus mutate?
Okay, Professor Anzala.
Yeah, it is true. For those who recover, they develop an immune system. They develop immune responses, both cells and antibodies to this virus. So to a big extent, yes, there is immune response. What we are now interested in is to learn how long this immune response can last. And the question we are asking that after you have suffered infection, are you prone again to be reinfected? Because if you are, then your immune system is not working. So those are the things. If the immune system is working very well and the immune response is good, then that is again the immune response we are learning that will lead us to develop a vaccine. Now, number two, in terms of mutation, yes, this virus is prone to mutation because of the way it replicates, As we speak, we now know that there are 2 circulating strains with a significant difference. We don't know how it will mutate, and that is the reason why, as we manage the patients, there's also an element of research to be able to understand the immune responses, how long these immune responses last, and also the mutations and what directions these mutations are taking, because all these things will advise in terms of treatment, in terms of development of new treatments, but all this information will also advise in terms of vaccine development.
Well, the next question, I will want to throw it to Dr. Paul Yonga, but before then, I just want to allow Professor Rodney Adam to just jump in quickly. In light of what Professor Anzala has said, there is also this rumor that was going around, especially in the UK, that they were allowing the numbers to really go high because they are trying to also to try and see chances of creating an immunity system, so to speak. I don't have an idea how that one works.
Well, with any kind of infection where you get long-lasting protection after your own infection, it means that it's harder for a virus to spread through a population. And it varies according to the virus, but if you have enough people who have immunity, then the virus doesn't spread. The problem is that you have to get to that level, and if you allow it to get to that level, you've already exposed a huge number of people and had a huge number of people develop infection, some of them dying. So the idea makes sense for some viruses. In this one that's new, it doesn't make sense.
It's pretty much taking a big risk. So let's listen into the next question, and it's about insects.
Can insects such as flies and mosquitoes transmit coronavirus?
Very interesting question from that young lady. Dr. Paul Yonga.
Yeah, so far we've not come across any evidence that seems to suggest that the virus can be spread through certain vectors, be it mosquitoes or ticks. So of course these are things that will continue being studied as we go along, but so far we've not had any hard evidence to suggest the presence of vectors or lice or mice as possible transmitters of this virus, no.
Dr. Massey?
No, just as Dr. Yonga has said, we don't have any evidence that shows any formites, any vectors, be they mosquitoes, the ticks, locusts. I've had people saying, are the locusts related to coronavirus? We do not have any evidence that we can have such transmission. Again, it's a new virus, and we are trying to learn as much as we can about it.
The next question is about the Mombasa ferry.
Swali langu ni kwa serikali kuu kuhusiana na hii corona. Je, mna mipango ipi kuhusiana na kile kivuko chetu pale Likoni ferry? Ama sisi watu wa pwani tumesahaulika tukawachwa?
So for my 3 panelists, I'm sure you understand that question, but for Professor Rodney Adam, what she's asking is, she's just raising concerns about the ferry in Mombasa because there are huge populations of people who cross the Likoni Channel using the ferry, and they feel like they've been forgotten around this coronavirus thing. I will start with Dr. Massey before I go to Rodney.
Right. So this afternoon, the Cabinet Secretary chaired the NERC, the National Emergency Response Committee. And in this committee, we have Cabinet Secretaries from the Ministry of Transport who are reviewing this situation. We've already issued directives concerning public transport with regards to the matatus and the public service vehicles. And we're currently reviewing to see, and at the right time, those measures will be announced to the public in terms of how do we ferry people in terms of the big ferries. The same will apply in terms of counties who may need to cross using boats. We've noticed people are crowding within boats, and this is going to be reviewed, and the NERC will be able to issue further instructions. So it's a matter that's under review right now.
So in short, what you're saying, Dr. is that perhaps maybe this week or in the near future, the same way there have been directives to try and reduce the number of passengers in our PSVs, we might see a reduction of numbers of those who will be crossing the Likoni Channel using the ferry.
So, Dennis, as different countries have intervened with regards to COVID-19, they've had to introduce sequentially and enhanced measures. So right now, the issue is under review, and as we started, if you remember when we had our first cases, Kenyans were still using public transport, but then the teams reviewing and trying to advise us in how we can best manage this situation emphasized we need to social distance more. And so therein, the CS was able to direct reduced capacities of matatus. As the situation evolves, as we monitor it, as we get more data, the NERC will be able to give instructions and directives. But then there's one big measure that Kenyans can help us: stay home. If you can, stay home, social distance, and avoid movement that is unnecessary.
And avoid the ferry, pretty much, that's what you're saying,
yes.
if you can.
If you don't need to be on a ferry, you know, for whatever purpose that, you know, extreme emergency, then don't be on the ferry.
Well, Professor Rodney Adam, you want to jump in on this and also perhaps answer this other one. It's just a follow-up to what the gentleman was asking about the tropical climate that we have in the country. It's very humid in Mombasa. And there are people who are arguing and saying the virus can't get to Mombasa because of that humidity.
Well, I think the issue of the ferry has been addressed adequately. It's about physical distance, which is probably a better term than social distance, but because we're trying to stay a certain amount distance away. And the next question again.
The question I was asking was about the tropical climate you have in the country and many countries in the continent. It's very humid in Mombasa, and there are people who argue that the temperatures there and the climate there does not favor the spread of the COVID-19 virus.
Well, first of all, that was coming up when we didn't have any cases in sub-Saharan Africa, or when very few countries had them. But the question there was, you can't even answer that question until you have your first case and know what the spread is like. And it's also worth remembering that this virus likes the temperature between 37 and 40. That's in the human host. And it doesn't have to take very long to get from one host to another. So there are a lot of hypotheses out there, but no good evidence that climate is going to have a substantial impact.
Well, thank you very much, Professor Rodney Adam. We have another question before we take a break from Ruben.
What makes it so dangerous in the human body? The second question, I've heard that the virus was engineered and that 4 components of HIV were added to it. Is that true? We expect that the coronavirus COVID-19 will have a negative impact on our already backward economy, hence reducing productivity and the gross domestic product. What measures can our government put in place to minimize the effects it will have?
Well, those are sort of like 3 questions in that video, but I'll throw the first one to Dr. Paul Yonga. What makes this very, very dangerous?
Yep. So far we know of 2 mechanisms. So the first mechanism that we've currently seen is that when the virus actually accesses your respiratory system, it binds into a protein that actually enables it to enter the cell. And by these cells, we mean the alveolar cells within your respiratory tract. So when it enters there, it sort of tries to uncoat itself, then tries to replicate within that cell. And then the smaller viruses try to coat again, and then it literally busts that cell open, and then those smaller viral components infect other cells, and that lowers your capacity to actually undergo the oxygen-carbon dioxide exchange. That's the first thing. The second mechanism is whereby when the virus enters, just as Professor Anzala mentioned at the very beginning, your body elicits some sort of immune response. It's more like soldiers trying to fight, whereby there's a bit of friendly fire. So some of these immune cells try to release certain chemicals that actually injure the lung. And then when the lung starts recovering, the lung becomes very stiff. So it becomes very hard for the lung to have its expansile capacity. So that's what brings about the respiratory distress that a number of patients present with in very critical stages. So literally, if there's no oxygen in your body, or there's compromise between the oxygen and carbon dioxide capacity within your lung, then that of course becomes fatal to people.
Dr. Massey, very, very quickly, the last bit about cushioning with the current economic status that we have in the country. I'm not sure whether you can authoritatively answer this, but from the government standpoint, how do you see this?
So what I can assure Kenyans is there are teams, the Cabinet Secretary of Finance, in Treasury, along with other high-level government officials working on this issue. And the world over, it's important to appreciate that COVID-19 has been able to distress the whole global economy. Different countries have seen different effects that have hampered the growth and productivity of their economies. The mere fact of social distancing and needing people to stay at home, of course, would have an effect on the labor force. But all these are issues that are under deliberation, and I'm sure within the right time, the president and his team will be able to inform Kenyans of measures that will be undertaken.
Well, I've seen Professor Anzala want to just quickly, before you take a break.
Then is the whole issue that this virus is similar to HIV, that some things were taken from HIV to make this virus is totally false. Also, the issue that this virus was manufactured in the lab is totally false.